This is Doc Vader, the most powerful clinician in the galaxy. You are listening to the Inside the Boards podcast. The force is moderately to severely strong with this one. Vader out.
Welcome to the Inside the Boards podcast, the podcast dedicated to helping you learn to think like a question writer so you can study smarter, not harder, and succeed in medical school. And now here's your host, Patrick Beeman.
Welcome to the Inside the Boards podcast. Okay, sorry, I just watched John Oliver, and that stuck in my head. At any rate, welcome to the Inside the Boards podcast. I am Patrick Beeman, your host. Just want to give you a few updates before we get into today's content. All right, so listen up, listen carefully. The Study Smarter series for the USMLE Step 1 and COMLEX Level 1 starts Monday, the 19th of March. But we're putting this content over on a different channel. You're going to have to go into iTunes and search for Inside the Boards Study Smarter series for the USMLE Step 1 and COMLEX Level 1 in order to hear those episodes. You can get more instructions on our website, InsideTheBoards.com. We just want to thank everyone for listening and helping make this podcast pretty successful, one that we're definitely proud of. And now we're branching out into even more content. Head over there if you want a little on-the-go USMLE Step 1 study prep. And as we've thought about how to raise awareness of this other channel, number one, we are going to ask you to tell your friends about the Inside the Boards podcast. Next, you're going to hear Stewart Bryant, our well-known producer and sometimes co-host, and Greg Rodden, who is in charge of the Med School Phys Podcast. Well, in this episode, he kind of talks about the USMLE and COMLEX kind of tests in general, and a little bit about osteopathic manipulative medicine. So to our osteopathic listeners out there, this is our way of saying, we hear you, especially those who, oh my gosh, take 2 Step 1s, the Level 1 of the COMLEX and the USMLE Step 1. My heart really goes out to you if you have to take both. But interesting discussion between Stewart and Greg coming up next. Part 2 of that interview. So if you want to hear Greg and Stewart on some cardiovascular physiology questions, is going to be over on the new Inside the Boards Step 1 channel. You can help support the Inside the Boards podcast. Just go to InsideTheBoards.com and click on the Support ITB button on the homepage to learn more. And for a limited time as well, we are offering our audio Q Bank. By 3 months now, get a month free. But if you go to the site InsideTheBoards.podbean.com, you can take advantage of that offer. You won't actually get any notification that the extra month there is free, but trust me, it'll be 4 months. And you'll have access to both the Step 1 level content and our Step 2/clerkship content. That's all I got. Here's Stewart and Greg from the Med School Phys Podcast. Enjoy.
You took both the COMLEX and Step 1, right?
Yeah, you got it.
Okay, so I guess walk me through the prep for those and if you did anything differently for each of them.
Sure. So for the COMLEX, I mean, really, you study the same way for the COMLEX and the USMLE. The main difference that I saw was just adding the OMM component. And I mean, this is something that almost every osteopathic medical student has heard before, is really you just need to read. There's this book called the Savary Screen Book.
I've heard of this book. Yeah.
Have you really? Okay. So clearly it's made the rounds.
I listened to an OMM podcast called Didactics Online because I was just curious about it, but I really don't have a good understanding about OMM at all. Could you, just for our listeners who don't know about that, could you describe what that kind of focuses on a little bit?
Yeah, absolutely. So OMM is osteopathic manipulative medicine, and they hate it when we make this comparison, but it's basically chiropractic medicine. Just it uses a different conceptual framework to understand the techniques and to justify the techniques that you're using. But when you're cracking somebody's back, you're cracking somebody's back. Like it's the same, you're performing the same physical maneuvers that a chiropractor would. But OMM, doctors who practice OMM tend to understand the practice as reducing what's called spinal facilitation. So the basic idea is that if you have some physical problem in like an organ, so let's say you have gallstones or something,
right?
So the sympathetic innervation to the gallbladder and to the liver basically runs from T5 to like T7 or 8 or 9, depending on the person. And we have these afferent sympathetic nerve fibers that are hyperstimulated in the setting of pathology, so like in the setting of gallstones. And so what you can find is increased afferent sympathetic input into the spinal cord, and then the crosstalk between nerves in the spinal cord will crosstalk with somatic fibers, so the fibers innervating some of the paraspinal musculature at the T5 to T9 level. And then that produces essentially physical changes in the tonicity of the muscles in that T5 to T9 area. And that produces what osteopathic physicians call somatic dysfunction, which is just a really vague term for physical changes of the body, and particularly of the musculature or the musculoskeletal system, so the muscles and the bones and the way that those joints in the spine articulate with one another, creating basically rotations and abnormal side bending of the spine, and that can create pain, but it can also like reduce the functional capacity of the patient. So it's this so osteopathic physicians basically understand the body as a unit.
Right.
So the liver and the gallbladder, which are affected by gallstones that form or whatever other liver pathologies or other gallbladder pathologies, are directly connected to the spine.
Right.
Is the idea
through the celiac plexus, maybe? Or...
Yeah, you got it. You got it. Yes, through the celiac plexus or the celiac ganglion, and the celiac ganglion basically it's associated with input and output from the T5 through T9 sympathetic neurons in the spine.
Right.
That's the basic idea. Is the organs are connected to the spine, and the spine is connected to the organs, and so the idea then with OMM is, one, we can reduce any discomfort that the patient might have in their spine, but then two, by correcting the somatic dysfunction, so by correcting the physical like rotations and side bendings that are causing problems for the patient, or the patient may not even notice them, by correcting those, we can hopefully reduce the amount of sympathetic input that's going back into the internal organs. So that's going back into the gallbladder or the liver.
So it's kind of like a loop.
Yeah, that's at least the theoretical framework that osteopathic physicians are working with. And so those connections are called viscerosomatic reflexes.
Is that a lot like referred pain and those sort of?
Yeah, exactly. It's almost the exact same concept as referred pain. But then osteopathic doctors also focus a lot on what's called spinal facilitation. So which is the input from the gallbladder that is basically irritating these nerves in the spine in the T5 through T9 area, will then crosstalk to somatic nerves that then increase the tonicity of the paraspinal muscles in that area.
Yeah.
So that's and that's just one
example.
One example of the kind of stuff that we learn
right.
in our OMM classes.
And do you use that more for like kind of like diagnostic technique or more for therapeutic technique? Like for instance, are you saying, do you have pain in this area? You're having pain through this spinal region that's related to, it could be the stomach, the gallbladder, or the spleen, and maybe we can provide some relief by manipulating that area.
Yeah. So you've got it. So the idea is that correct, we can use it for diagnostic purposes. So if we suspect like a peptic ulcer or something, we can basically screen the spine in the T5 to T9 area, or also if we're thinking about like the parasympathetic side of things, we can screen what's called the OA joint, or the occipitoatlantal joint, and C1, C2, and C3, because of that area's connection to the vagus nerve, basically. We can look at those areas and see, is there somatic dysfunction that might correlate with some kind of GI pathology, with a peptic ulcer or whatever. And then on the flip side, this is a little more controversial, but can we basically reduce the internal pathology? Can we reduce the symptoms of the peptic ulcer, or reduce the symptoms, or even improve the actual underlying pathology of the peptic ulcer, essentially heal the peptic ulcer with manipulation.
Interesting.
By reducing the sympathetic stimulation, or normalizing the sympathetic to parasympathetic innervation to these areas, can we help to fix the underlying pathology as the main idea.
Okay.
Not everyone is convinced by that. In part because the sensitivity and specificity of these associated paraspinal changes with internal pathology isn't always too great.
I hate to burst bubbles, but like neither is a lot of like physical exam maneuvers anyway. So it's not like we're perfect with everything we do.
right. Absolutely. But that's kind of like the theoretical framework that osteopaths work with. And I mean, some of it, it's amazing. Like it's exactly when you see these problems in the clinic, it's exactly like what they say in the classroom. And then sometimes it's like, yeah, I'm not seeing that, but I'm a third year medical student at this point. So I need to be humble and understand that I haven't seen nearly as much as these physicians have seen. And so I can't, just chalk everything up to confirmation bias or whatever.
Yeah. And, even, something like a heart attack, you don't always have the typical presentation, and that's lines get blurred with this kind of stuff. Yeah. I think the, sensitivity and specificity of like a pulmonary exam is actually pretty terrible compared to, like doing an ultrasound of the lungs, for instance. And, you just have to be able to appreciate that you may or may not see something, but it's important if you do, right, that you follow up on it.
Right. Absolutely. And there's also something to be said about, like, while you can knock the sensitivity and specificity of some specific exam maneuver, or some specific osteopathic finding that you might find, every time you're looking at a patient, you're looking at the whole patient. You're looking at what does their constellation of symptoms tell me, and what does their story tell me? And I mean, I swear, almost all the time you can narrow it down to 1, 2, 3 of the most likely things, right? And that's what the differential diagnosis is, right? Just based off of history and physical exam alone. And so when you're looking at the whole patient and when you're listening to what they're telling you and you're paying attention to these exam findings, you can get a pretty darn clear idea of what's going on and what your next step is.
Oh yeah. And I bet it just helps because you're actually taking the time to interact with the patient a lot more. And, you know, for instance, as a medical student, they want us to do a full head to toe exam when we see a patient, but a full head to toe exam will take like an hour for me to honestly do, to do it right. You know, I can do it in 15 minutes, but do I always get it perfect? Probably not. And, you know, I bet that helps teach you a lot more about how to do those things and actually interact with the patient. And there's a lot to be said for, you know, actually working with the patient and not just speaking with them and running off with your differential like that, especially for their own perception of what the doctor does and how the doctor helps, you know, like the healing touch kind of thing.
Mm-hmm.
That was a good overview of OMM. It really cleared up a lot for me, but I think we really turned from talking about what you did for your boards. So I'm going to try to reel that back.
Yes. Yeah.
Because I did want to know that because I haven't gotten clear answers from listening to people about it. All I know is that DOs are a lot friendlier and nicer to interact with than some doctors that you find. I'm not sure. That's just my personal experience, though. So there's a lot of bias there.
Right.
But yeah, what did you do for COMLEX and USMLE, I guess?
One thing before I get to that, I'm going to stand up for MDs a little bit here. Honestly, it just comes down to the person. I don't know if these broad generalizations
they're definitely broad
about DOs and MDs are accurate, at least according to my personal experience, my anecdotal evidence here. But anyways, so
keep me in check.
What
right?
did we do? Yeah. So what did we do about preparing for the COMLEX? So like I mentioned, the Savary Screen Book is, I found it to be an excellent resource that basically just gives you this comprehensive, it's a comprehensive exam preparation tool that talks about basically all the different kinds of concepts OMM concepts specifically that you could encounter on the COMLEX. It's a little notorious because there are a lot of errors in it, and that even I noticed as a second year medical student. I was like, "That's super wrong, dude." And plenty of people have noticed those issues too. So he kind of needs to come out with a new version of it, but it's just a very straightforward resource with plenty of practice questions at the end of each chapter and like full length practice tests at the end of the book. I think there's like 4 of them and they're pretty good. I would definitely recommend the Green Book to anyone. I just haven't checked out other comprehensive OMM books to be able to comment on them, which I probably should have done ahead of time. But also I would recommend a COMLEX specific question bank for osteopathic students, just to see what the OMM questions are going to look like. Because while Savarese has some solid practice questions at the end of each section, the questions are very first order. They're very straightforward. They're really not meant to be board style questions. So
cool.
I would highly recommend something like ComBank or ComQuest.
ComQuest, yeah.
I've personally used ComBank the whole time, and it was just because my school provided it to me. And
that's nice.
I found that, and then I found that ComBank, the style of the questions very close. I found that it very closely matched what I saw on the COMLEX.
Cool.
And some people disagree, but that was my interpretation of it.
Yeah, I can debate left and right with people about Q banks and whether or not they're any good, and that's a lot of people hate on osmosis, for instance, because they have some questions that maybe they don't get into the right detail, or they're not testing really the important fact of that objective. But I think you have to be able to read between the lines a little bit with what they're testing. And I find I even find things wrong with like UWorld, for instance. So nothing's perfect, and if you're expecting something to be perfect, then you're probably not setting yourself up right in preparation.
Yeah, agreed. Yeah, you're gonna need to use more than just one single resource, but don't try and use like 7 or 8 because you'll just overwhelm yourself.
For sure. No. So, what did you do? Did you do much differently for step 1?
Honestly, no. So the COMLEX and the USMLE Step 1, as far as basic science content goes, I mean, they test in a very similar manner. What I found on the USMLE was that the questions were a little more esoteric than they were on the COMLEX. I thought the COMLEX was asked questions in a bit more of a straightforward manner where you didn't have to read their mind as much.
That's good.
To be able to answer the questions. So, but the concepts that they're testing, I mean, they're all the same concepts. So like if they're going to ask you about cardiac output and the main determinants of cardiac output kind of thing, they're testing you on the exact same concepts, and they're going to ask you similar questions about that concept. They're really not that different in the arena of basic science. Really, the main difference is with the COMLEX, you also need to prepare for the OMM portion of it. And then also on the COMLEX, like even if they're testing you on a basic science concept, in the vignette, they'll add and he also had somatic dysfunction in the T5 through T9 area, whatever, side bent left, rotated right, etc. So they'll kind of throw in little hints as to where the underlying pathology is or whatever.
Oh yeah, okay. And I know the vignette length is always a big hamper for students. So but it gives you all that detail. Like if you know the physical exam findings, you know the lab findings and what they correspond to, you're going to know what they're talking about when you look at one of these questions.
Yeah.
I know Golyan really tried to press that, if you know that information, you're 90% of the way there to figuring out what they're going to be asking about.
Right. Yeah. So for example, something like, I don't know why I keep thinking about GI examples, but
it's good. I got GI like coming up down the road.
Yeah. So something like ascending cholangitis, which is an infection of the biliary tree that can become really dangerous. Usually after a gallstone gets stuck in the common bile duct. If you notice that the patient has fever, right upper quadrant pain, and jaundice, I think that's Charcot's triad or something like that. They're not going to use the word Charcot's triad, but they're going to tell you their temperature is 101, their skin is yellow, and they're complaining of right upper quadrant pain. You're like, okay, this person has ascending cholangitis, and we need to do boom, 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 boom. That's the kind of thinking. And so what I found helped me to perform well on the test really was doing lots of practice questions and recognizing how they present that information, because they're not they're not going to explain it to you in that manner. They're not going to, put all three of those findings right next to each other. Like they're going to throw in some intermediary sentence that will almost try and distract you, which is annoying to think about, but they'll throw in some intermediary sentence and you might lose that trail. And so the key is recognizing those three findings. Like that's the diagnosis. Keep moving, and be confident in your choice. And what I found helped me to develop that skill was really practicing that skill with practice questions, with board style practice questions.
Awesome. And that's sort of what I'm planning to do, really, just to kind of regress and talk about what I've got planned. Like I mentioned to you that I'm going to start my board prep tomorrow, and officially, I'm going to have like time set aside to do questions, and that's probably going to be the main kind of preparation I do, mostly because I want to see how things get presented. And it's almost like a weird idea that if you see all the presentations set up in like a board style vignette, then you won't be surprised when you get to the test and you see that same vignette come up. And whether or not that's going to get you to the basic science of it, that's, hopefully if you've done enough of them, they've really hit on the important features of all those presentations, maybe. At least that's what I'm hoping for. And we'll see how that turns out. And I'll definitely be reporting to everybody whether or not that was successful for me. But yeah, I'm kind of, I feel pretty good about this method and not spending too much time reading a book where I'm not really applying, that kind of thinking or that critical thinking that you're going to be doing while you're taking the test,
Mm-hmm. Yeah. And I mean, I think that that's completely reasonable. So when I prepared for the test, I did end up reading through first aid a couple of times and reading through those kinds of resources. And overall, I think that the practice questions were absolutely higher yield than reading through first aid. And honestly, I read through first aid because other people said it was a good idea.
Everybody says read through first aid.
Yeah, I didn't think that, I didn't really think about it for myself. And honestly, I think that your approach makes a lot of sense. And earlier you also mentioned using first aid as a supplemental resource rather than using it as a primary, I'm going to sit down and read this many pages per day kind of thing. I think that's a really reasonable approach.
Right. And it's reasonable for me to say if I miss a question in one of these Q banks and not just being tricked by the question. It's one thing if I knew the answer and then I put this very similar thing because I was thinking, well, it's kind of hard for me to differentiate those things. Maybe I won't look in first aid for something like that. But if I outright flat out miss a question or see a question I have no idea, I'll probably look up in first aid about that question and see what's going on in first aid, at least to, kind of give me that basis for why I missed something and why I don't feel very informed about it.
Mm-hmm.
But to sit down and read the I don't know, they have like tables in first aid, which will have like 20 genetic disorders. And, then they write a sentence about each one. And I'm not sure I'm going to, it's one thing for me to read it, but I'm not going to remember any of that in 20 minutes, let alone in 6 weeks when I actually take a board exam.
Right. Yeah. Yeah. And so for a topic like that, when you're trying to remember like the fine distinctions between, I don't know, rare causes of immunodeficiency or something like that, like genetic causes of immunodeficiency. I'm trying to, like chronic granulomatous disease and those kinds of things. I seriously I found what stuck with me was using something like Picmonic, really helped. Just being able to recognize those key aspects of different diseases in a picture form just worked so much better for me than tables. Like you, I can read something and like half an hour later just completely forget most of the information that I read. And I'm a slow reader on top of that, so it really disincentivizes reading for me. But that's a different topic.
No, that's I think that plagues a lot of people. And I like how Picmonic does things, and Sketchy Medical has a lot of great ways to help you really like latch on to this material. And even a year after watching a Sketchy video on something like tularemia, I can remember the sigh in the garden that you'd want to treat it with an aminoglycoside. And, I can get a question right because of that. And that's completely ridiculous. There's no reason I should have that in my head anymore. But for some reason, that just clicks and just something stayed.
Yeah.
And, maybe you only keep one fact from each of those images, from just like casually watching them, or maybe you sit down and you actually study those images. Either way, it's going to help with that memory tool, Yeah.
And that's just, that's what I found to be the most effective approach for just true brute force memorization of facts and memorization heavy topics like microbiology, like pharmacology, like rare genetic diseases. That's what I found those resources to be the most helpful for. But I found that at the end of the day that practice questions are the best resource overall for me.
Yeah, and I think a lot of people on the other end of it are very, very much in agreement about doing the questions and less on, reading a textbook or anything like that. All right. So not to kind of speed us up a little bit, do we want to do a couple of these questions?
Yeah, absolutely. Absolutely. Let's do that.
Whoa, hang on, Stewart and Greg. You're on a new channel now. So there's that. If you want to hear the rest, go to the Inside the Boards Study Smarter series for the USMLE Step 1 and COMLEX Level 1 on Podbean, iTunes, or wherever you listen to your podcast. Please leave us a good rating and a review of the show. Thanks for listening. And thanks to James from 2 O'Clock Courage for letting us use the opening track, which is The Valentine Blast Furnace off 2016's album Missalette. You can check 2 O'Clock Courage, the best band you've never heard of, at 2o'clockcourage.com or on iTunes or Spotify.
Inside the Boards is in no way affiliated with the United States Medical Licensing Examination, Comprehensive Osteopathic Medical License Examination, National Board of Medical Examiners, the National Council of State Boards of Nursing, National Board of Osteopathic Medical Examiners, or any other licensing or examination body. All exam names and other trademarks are the property of the respective trademark owners. Content discussed during the program is the property of Inside the Boards or the attributed trademark owner and may not be reproduced without permission from the appropriate entity. Inside the Boards fully adheres to the respective policies on irregular behavior outlined by the aforementioned credentialing bodies.